Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to Let's Medicine. This is the series of osteology of skull जिसमें हम नॉर्मा बिजालिस डिस्कस कर रहे हैं। हम नॉर्मा बिजालिस की पिछली 2 वीडियोस में उसके एंटीरियर और मिडिल पार्ट्स को ऑलरेडी डिस्कस कर चुके हैं और इस वीडियो में वी विल टॉक अबाउट द पोस्टीरियर 1/3 ऑफ द नॉर्मा बिजालिस। सो फर्स्ट ऑफ ऑल वी विल हैव एन ओवरव्यू ऑफ द डिफरेंट पार्ट्स ऑफ द नॉर्मा बिजालिस। The norma bizalis is divided into 3 portions: the anterior 1/3 part, the middle 1/3 part, and the posterior 1/3 part. जो anterior 1/3 part है वो anteriorly alveolar arch of the maxilla से लेकर posteriorly the free margin of the hard palate तक extend करता है। उसके बाद जो middle 1/3 part है that extends anteriorly from the free margin of the hard palate till the imaginary line जो कि foramen magnum के anterior aspect को cross करती है. So this portion in between these two boundaries is the middle 1/3 of the norma bizalis. Now coming towards posterior 1/3 of the norma bizalis, that is the main topic of today's video. It extends from the imaginary line anteriorly till the external occipital protuberance posteriorly. For the ease of understanding, the posterior part is also divided into 2 main sessions or 2 main portions. One is the middle portion or the median part of the norma bizalis posterior aspect. ये जो middle part है, जो median part है, that basically extends from the lateral margins of the foramen magnum up till the superior knuckle lines, like this. और इसके बाद जो lateral aspect में हमारे पास portions आते हैं, these are basically the lateral portions of the posterior view. So सबसे पहले we'll talk about the median portion of the norma bizalis posterior aspect. This is the foramen magnum and this is the largest foramen of the skull. इसको हम 2 halves में या 2 compartments में divide कर सकते हैं. One is the anterior compartment, that is also known as the ligamentous compartment, and the other is the posterior compartment, that is also known as the nervous compartment. जो anterior compartment होता है इसके थ्रू हमारे पास कुछ important ligaments क्रॉस करते हैं जो कि cranial cavity से spinal cavity तक जाते हैं. इसी तरह जो posterior compartment है that is the nervous compartment जिसके थ्रू हमारे पास lower part of the medulla oblongata along with the associated meninges क्रॉस करता है. That will then continue as the spinal cord. So basically the foramen magnum provides a communication between the cranial cavity above and the spinal cavity below. Now coming towards the posterior aspect, तो यहाँ पे जैसा कि हमें पता है this is the main point, that is the external occipital protuberance, and on both sides of this protuberance हमारे पास superior knuckle lines cross करती हैं. So this is actually the demarcation point between the head above and the neck below. External occipital protuberance और foramen magnum के दरमियान यहाँ पे हमें एक elongated सा projection नज़र आता है and this is basically known as the external occipital crust. Just on the midway जो external occipital crust है इसकी दोनों sides पे inferior knuckle lines cross करती हैं here. So this is basically the part that is involved in the median aspect of the posterior view of the norma bizalis. And this whole portion is basically made up by the squamous part of the occipital bone. Now coming towards the lateral aspect, तो foramen magnum की दोनों anterolateral sides पे अगर हम notice करें तो यहाँ पे हमें 2 condyles नज़र आते हैं and these are known as the occipital condyles. These are basically responsible for the formation of a joint between the first cervical vertebrae and that is known as the atlanto-occipital joint. Lateral to these occipital condyles यहाँ पे हमारे पास एक आपको projection नज़र आएगा, that is a pointed finger-like projection and this is known as the styloid process. Styloid process पे हमारे पास different muscles की attachment होती है and this is basically present on both sides. Just lateral to the styloid process, we have a conical shaped projection that is a part of the temporal bone and this part is known as the mastoid process of the temporal bone. ये भी हमारे पास norma bizalis में involved होती है. This mastoid process of the temporal bone has the mastoid hair cells inside and just medial to the mastoid process हमारे पास यहाँ पे एक depression run करता है that is known as the digastric fossa. In between the styloid process and the mastoid process, we have a foramen that is known as the stylomastoid foramen, and this basically gives the passage to the facial nerve along with the stylomastoid artery. Now coming towards a very important structure that is present between the petrous part of the temporal bone and the occipital bone. And this space or fissure is basically known as the jugular foramen. जो jugular foramen है that basically transmits the 9th, 10th and 11th cranial nerves along with very important venous structures that includes the internal jugular vein and the inferior petrosal sinus. सिमिलरली अगर हम ऑक्सीपिटल कॉन्डाइल्स के सुपीरियरली नोटिस करें तो दोनों साइड्स पे यहाँ पे हमें एक फोरामेन नज़र आएगा एंड दैट फोरामेन इज़ बेसिकली और दैट कैनाल इज़ नोन एज द हाइपोग्लॉसल कैनाल. हाइपोग्लॉसल कैनाल जो है दैट विल गिव पैसेज टू द हाइपोग्लॉसल नर्व. This was all about the important bony landmarks of the posterior 1/3 of the Norma Basalis. इसी के साथ हमारी Norma Basalis की सीरीज़ जो है that has been completed. Thank you for watching.